In this video, we're going to talk about how long does it take to recover from a hip replacement surgery. And towards the end of the video, I'm also going to talk about life of the implant. So let's dive in, friends. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. So recovery from a hip replacement surgery depends on multiple things. And the most important of them is your surgical technique. As you know, we do minimally invasive total hip replacement surgery, which leads to a quicker recovery. But other factors are which stage of the disease were you when the surgery was done? What is your age? What is your desire to get back to normal life? And that's why the pre-operative counseling is very, very important. So when I speak to my AVN patients or ankylosing patients before the surgery, we set their expectations. So we tell them according to their muscle power before the surgery, the limp before the surgery, the pelvic tilt before the surgery, and also the bone damage which has happened because of the disease process. But I'm going to tell you on an average how 80 to 90% of the patients recover after the surgery, because most of the patients reach us at a stage where fast recovery can be ensured. Now let's understand what happens after the surgery. Do you know what is the most exciting thing after the surgery? When I meet my patients, when they're in the operation room, when the surgery is over, when I go and say hello to them, they're like, "Ho gaya, sir. The surgery is over." So that's the first relief, because you have been stuck at that space for such a long time thinking whether I should do surgery or whether I should postpone my surgery. But when you have decided and the surgery has been done successfully, that's the first sigh of relief. Then the patients come out into the recovery room and the next thing my patients ask, "Are my legs equal?" I feel so good when almost every single time I can tell them, yes, your legs are equal. You must have seen in my videos that sometimes because of pelvic tilt, you may feel that your one leg is short or long. And when that pelvic tilt corrects, the legs become equal, because during the surgery, we make the hip joints equal. The pelvic tilt correction happens in due course of time. And that's why when I mentioned that it depends how long were you suffering from that disease, how bad is your pelvic tilt. If the pelvic tilt is there, some patients experience that my leg is little longer after the surgery. Some patients feel my leg is slightly shorter after the surgery, but it is not. It is apparent shortening or apparent lengthening, which means you see it, but actually when the pelvic tilt corrects, it's going to be equal. In the first few hours, like 2 to 4 hours, as soon as the muscle power comes back, as soon as you are able to wiggle your toes, you are able to bend your knee, move your leg, my physio team will come and make you do some exercises in the bed, make you sit in the bed, and if you're comfortable, then make you walk with support, which could be a walker, which could be a crutch, depends on your balance level, depends on your pre-operative muscle strength. So that is happening within 2 to 4 hours of surgery. After that, my patients are doing well through the day, and when the night comes, there are certain instructions. We tell our staff to give you a pill which helps you in sleeping. All my patients are able to sleep on the side. We put a small pillow between the legs, and my physio team teaches you in how to take a side turn on your own without seeking anybody's assistance. A lot of patients who undergo conventional hip replacement surgery are not allowed to do that for sometimes 4 to 6 weeks also, and they are asked to keep pillows between the legs. On case-to-case basis, you may have special instructions like in revision hip replacement, but majority of the patients do not have it if we have used the best surgical technique. So the next morning when I come to see my patients is still within 24 hours, and typically before I go to perform my surgeries of the day, I go see all my patients who have been operated a day before. Most of them are having their breakfast, having their tea or having fruits. My physio team will come, they'll make you stand and walk again, and they'll see how balanced you are. And if you are balancing well, then we make you walk with the help of a support on the side wall, not even with a crutch. At least 50% patients can do that. And if you're able to do that, we know that you're recovering fast, because in 48 hours after the surgery, you're going home. A lot of patients choose to stay for 2-3 more days in a hotel and meet me, show me a dressing, and then go home. Once you have been discharged, we want to see the dressing at 5 days. If you are in Delhi, you come and see me. If you are from some other state, then we ask you to get your dressing changed by a qualified person. And how the dressing should be changed, we educate our patients on that. I have a full video on it and you can go and watch it also. We'll put the link in description. But once the dressing is done and if it is dry, then your antibiotics are stopped, your pain medications are already at minimum. By 2 weeks, you are able to walk around comfortably inside the house for sure and outside the house also. You can take small walks. My patients send me their mobile snapshots. Okay, doc, I did 3,000 steps today. I did 4,000 steps today. And the whole day, I keep receiving such messages and I keep smiling. The process of recovery goes on, and by 4 weeks, 3 to 4 weeks, most of my patients are able to resume their office work. They can go back to their office if they have a desk job. And people who have field job, who need to use the bike, meet people in the field, maybe 4 to 6 weeks is the time. Now, whatever timeline I'm using, whatever numbers I'm using, in terms of recovery is an average number. Few people take more time, few people are even faster than this. So that depends from case to case. It is just to give you a fair idea on how the recovery process happens. Please remember, whatever I'm telling you in this video is from the perspective of how I treat my patients and what protocols we use. I understand that different protocols can be there in different parts of the country or different parts of the world. So I would strongly recommend that you discuss with your surgeon in details and follow what he tells you. Having said that, I have a full series of videos on how to choose your surgeon, how you recover, and all other questions around the hip replacement surgery, which you can find on my channel. And the link for those videos are in the description. Let me take the video further now. And that brings me to the second part of the video. How long does the implant last? Fairly common question. Almost everybody asks me that. 80% of the patients after a well-performed hip replacement surgery using ceramic on highly crossed-in poly bearing do not have any problem even at 20 years of the surgery. And 58% of the patients do not have any problem even at 25 years. So I hope in this video I gave you some clarity on the recovery process and how long does an implant last. Still, this is a burning topic and I've seen people coming up with new questions around these topics. And if you have any such questions, put them in the comment section and I'll try to make a video on it, or I'll try to answer it in the comment section. Thank you so much for watching my content on AVN and hip replacement surgery and for giving so much love to our channel. I'm grateful to you because you helped me in achieving my mission of helping all the hip and knee patients across the country and in the neighboring nations. Thank you so much for watching.